I'm ready.
Everyone ready?
Ready?
Cameras ready? Okay. So, anyway, no, I was just going to say this is the graduate practicum group from this year. They're looking at the CalFresh Enrollment Gap, and I'm really glad that some of you that you guys are here for the next cohort coming in, and look forward to working with you and enjoyed working with you guys. Good luck.
Great. Thank you for coming, everyone. We did not expect to have much of an audience at all, so this is great. So my name is Hansae Catlett. I'm a joint MBA MPP student.
I'm Angela Gong. I'm doing the Education and Public Policy joint master's.
My name is John Bonacorsi. I'm a JD MPP.
I'm Michie. I'm also doing the joint Education and Public Policy master's.
And so our practicum this year focused on closing the CalFresh enrollment gap. So this afternoon we're going to take you through a brief and quick background on CalFresh, walk you through the research questions, and then a bit of a high-level overview on our methodology, and then spend most of the time digging into our findings and policy recommendations.
All right, so by way of background, just to make sure we're kind of all starting from the same place. So CalFresh is California's primary food assistance program. It's California's version of SNAP, or what was formerly known as the food stamp program. And there's a number of eligibility requirements in order to access CalFresh, but the two primary, if we're really boiling it down, is an income and immigration status. So in terms of income, you just need to fall below a certain threshold in order to qualify, and then in terms of immigration status, generally you need to be a citizen in order to qualify for CalFresh. The next important aspect about CalFresh is its program structure. So the CalFresh, it's federally funded, it's state supervised, and it's county operated. And the fact that it's county operated makes California unique. It's only one of 10 states that administers its SNAP program on a county level. And so this is something that we'll return to as we're thinking about legislation and like what potential things can be done to improve the enrollment gap. And to give a little bit more background about the program structure, so the California Department of Social Services is responsible for overseeing CalFresh, for administering it. But as I mentioned, SNAP, it's a federal program, so the state really can't just do whatever it wants to reform CalFresh. There's a lot of federal requirements that are already just mandated and instituted that cannot be changed. But fortunately, there are something that are known as state options. And the way that you can think about this is just carve-outs in federal law that allows states to customize their own programs in a way that they see fit, and so that it can best suit their needs. And so this is something that we're particularly interested in, because this is where some of the work can be done to improve the enrollment gap. And so just one example, so something like recertification requirements, which we'll hear a little bit about later. A state just can't get rid of the recertification requirement. But under these state options, it does have some leeway in determining how often is this going to happen. Is it going to be every 6 months? Is it going to be a year? Are we going to let elderly folks have to recertify less often? Things like that. So just to get folks thinking about what type of reforms might be possible. And then the second factor is what I mentioned earlier. It's just the county administration. So the fact that the state's overseeing it, but really maybe the best way to think about it is there's really 58 little CalFresh programs running at the same time in the state of California. And then the final point that I wanted to highlight, in terms of background, is the program's impact. So CalFresh, in 2016, the last year that we had data, it reduced both poverty and child poverty more than any other social safety net program in the state. So this is something that attracted us to the program. It's demonstrated its impact. It's definitely shown that it's able to support folks. So this is one reason we were interested in it. And that brings us to the CalFresh enrollment gap. So what ultimately drew us to CalFresh is the fact that, yes, it's this impactful program, but on the other hand, there's many people who are eligible and can receive benefits, but aren't receiving them. So as you'll see here, California's participation rate in 2015, it was 70%. And so this is well below the national average, and only 3 states that year fell below California in terms of participation rates. So there's a lot that can be done to improve this. And so what that means in terms of people, it means that there's ultimately around 1.7 million people who are eligible to receive benefits. They're entitled to them, but they're not receiving them. And so this is what we were looking to address with our project.
So in thinking about how do we understand the enrollment gap, we formulated 3 research questions. So understanding what's happening, what is the process for enrollment recertification, and how do those differ across demographics and counties? What's legislative context, so what's been done in the past, successful or not, and what's being done now, and what are barriers that people are experiencing, and which are the most important. So here's our methodology. We call this a basic interpretive study. We started with a lit review to give ourselves an understanding of the context and the barriers that come up in the program from previous studies and strategies that counties and the state have taken to address those, to frame the study. And then we conducted semi-structured interviews to understand people's actual experiences. And we interviewed 4 types of experts. So one are county and state level agency staff, people actually administering the CalFresh program. Community-based organizations that often partner with these agencies to do things like enrollment and outreach. Research and policy experts and advocates who have been in this research for years, and benefit recipients themselves, people who've been through the process. And these were iterative, where as we talked with people, people would give us resources or hit on ideas that we thought were interesting, and we would go back and dig more into the literature. And then our analysis is a combination of grounded theory, where we're looking at what people said and looking for emergent themes that surprised us, and also doing this analytic induction, where we're bringing a framework of hypotheses that we already had to the analysis. So our interviews were semi-structured, meaning we had questions that we wanted to ask people, but they were a little bit flexible. They were flexible in, depending on what people said, we could follow up in different ways or probe a little bit deeper. And we tailored them to the specific context. So community-based organizations was a little bit different than counties. And then as we analyzed them, we thought about what could we learn from whom, and how did that inform our view of the barriers. And Molly and Hansae are going to talk a little bit more about the ranking, but the main, what we call the main barriers, we ranked sort of by counting how many times they occurred and who said what. And the structural barriers that we uncovered were interesting, but we didn't count them because their nature is different. We'll talk about that in a little bit. So here's just the layout of what kind of expert we interviewed and how many total interviews we had. So we had 22 interviews, we talked to 40 people.
So our first research question was focused on just the enrollment and recertification process generally. Like, where are people, like, are they even getting on the program? Are they getting on the program? Are they falling off? Just kind of trying to get a lay of the land, and then seeing, you know, looking across counties, looking across demographics of what's going on here. So just to give everyone a brief overview. So in terms of CalFresh enrollment, there's just 3 parts. There's the initial application, there's an interview, and then there's verification. So verifying information such as income, things of that nature. And then in terms of staying on the program, there's what are known as reporting and recertification processes. So the first is the reporting one, which is the semi-annual report. And that just occurs 6 months either after you first applied or after you were last recertified. So it's kind of like a mid-year thing. It's just 1 page, front and back, where you fill it out, you're pretty much saying no changes have occurred. So it should be kind of a minimal process. Then the second aspect is recertification. And that really it constitutes reapplying to the program. And you know, so obviously these are places that we were focused on, because you could see a lot of people potentially falling off there, you know, if they didn't, you know, stay up to date with the semi-annual report or the recertification process. And so in our conversations, as I think Angela mentioned, we spoke with a lot of different agencies. And so in our conversations with them, you know, while the state, you know, has one program, CalFresh, we really learned that it's being administered differently across the counties. And so the first thing that we noticed is just how interviewing scheduling is being conducted. So in the most basic form, an interview would work where an agency sends you a letter that says, this is your interview time, and you know, we'll call you then, and this is when it's going to happen. But obviously that's not taking into account your schedule, what you're doing. You're maybe getting a call from the block number. It's just not maybe the best way to reach folks. On the other hand, we saw some counties, you know, taking more initiative, doing something called flexible interviewing. So they send you that same letter, but they'd say, actually, here's your interview time, but you can also call us at any time. We'll process the interview then, we'll make sure to answer, things of that nature. Or even having someone doing like what's called a warm call, where they call you directly and see if they could set up a time or even do an interview then. So that was one place where we saw a lot of differences. The next was even just like how applications are being received and processed. So one county that we spoke with, was more rural, and so they talked about how, people struggle with phone access. They struggle with getting internet connection. So for them, in-person communication is a lot more important to them. And then even something like online portals. There's a lot of different ways that folks can apply online. But each one, there's a lot of different ones. So the interface that you're using, the customer experience can really vary there. And that's what kind of just takes us to county capacity. As you might imagine, there's different resources in each county. Some places have call centers so they could process a bunch of people calling and doing interviews at once. Other places did not have those at all. There's something else called telephonic signature, which is a county's capacity to pretty much record you saying your name over the phone, and it counts like instead of you signing a document. So that really creates, it's much easier than to process applications, and if like something wasn't signed, to get it signed then. So some places had it, others did not. And then finally, just client outreach. So the extent to which different counties would like use technology such as text messaging to let someone know about an upcoming appointment, their willingness to partner with community-based organizations to be out at community events with applications helping people apply. We just saw a lot of variety in terms of how much they were invested in doing that. And so then what this meant like across the state, what did this look like? So one thing that we noticed like with enrollment was that the elderly folks were really not accessing the program in a way that we would want. So a study has shown that only 18% of elderly individuals who are eligible are enrolling in CalFresh. So that's a massive gap. There's many people there who could be receiving benefits but aren't. The second thing that we noticed is that students were really having a hard time accessing CalFresh. We really struggle to find data on this because there's so many eligibility requirements that it's just really even hard to determine who's eligible. But four of the five counties that we spoke with talked about, they really emphasized how difficult it was to get students enrolled. And they didn't see it as something where students were just categorically ineligible. Instead, they saw all the requirements as something that were just like hoops in the way of them, accessing the program, or just a deterrent where people just wouldn't even go through the bother. And then finally, we just saw a wide variance across the counties. So both in terms of the enrollment rates across the state and something known as churn, which is pretty much how many people are on the program, then fell off, and then are reapplying. We saw a very wide range of results. So let's talk about enrollment rates, for example. So as I mentioned, California's is around 70%. But we saw some counties that are well below, below 45%, and others that are up near 100. And so on the one hand, that's optimistic, some places are doing it well. On the other hand, wow, they're doing it very differently with what's going on. And so this leads us to our second research question. And as we mentioned, our client is a state senator, so we were very focused on what like state legislative reforms might be possible. And so we were interested in first what work has been done, and then second what's going on now, where might some opportunities be. And so the simplest way to maybe think about CalFresh, I guess, legislation reforming the program over the last 30 years is that it's gone from more restrictive to now trying to reduce barriers. So we've highlighted here a few reforms for you that kind of just show, these are over the last decade, that show like the tenor of what the legislature has been going for. So like removing asset tests, there used to be a drug felony disqualification, so getting rid of that, ending fingerprinting, really just ways to remove some of the barriers that would keep people from applying or accessing the program. And then we looked at more recent legislation, like so what's going on now, and we tried to like get a sense of what's going on thematically. And so one thing we noticed is the bills that were intended to improve data sharing, so maybe a county eligibility officer's ability to access data from another program, or for like if someone moved, like that data sharing, that those types of bills were being knocked down. And we also saw bills that were focused on horizontal integration being defeated as well. And so horizontal integration is like if you're applying for Medi-Cal, that same information being able to be used for your CalFresh application. Same thing applying for healthcare, things of that nature. So we noticed that there was defeats there. And then there's a number of reasons. People mentioned like privacy concerns with the data sharing. In terms of the horizontal integration, some state officials are claiming we're already doing it well, we don't need another bill, more red tape. So that's one of the themes that we noticed with recent legislation. But on the other hand, we did see some areas where the legislature was really consistently able to get things done and improve the program. And so one is promoting outreach. So for one example, one bill like let counties communicate directly with folks through text messaging, would notify Cal Grant recipients of their potential eligibility, so that type of outreach. And then the other is just supporting special populations. So a lot of bills were targeted at helping elderly folks and students. And so then that brings us to kind of what's going on now. So this year there's been 4 bills that have been introduced that we think help represent where the legislature is headed, or at least focused. And so the main way to summarize it is if you look at the top 2, it again stays with that helping certain populations. So students, for example, making sure that students are trying to improve access for students. And then what you can see on the bottom is that some of that horizontal integration and data sharing that I was talking about, some legislatures haven't let go of that, and we're still really trying to make sure that our different benefit programs are speaking to each other, and that people can kind of go through more of one process versus multiple.
So after we looked at the legislative context, we really wanted to step back and learn from our interviews, as Angela was explaining, about what they experienced as the biggest barriers and what those barriers were really like. So we really looked into how they were experiencing the barriers and then sort of tried to analyze which were the most significant. And as Angela mentioned, one of our first analyses was to sort of think about who was ranking these barriers as their main barrier. So we started our interviews with a question about what do you see as the main barriers to CalFresh enrollment? And then we also asked them a question towards the end of the interview about what they would most like to change about the current process. So tallies of these, and then in a few cases when they really emphasize something elsewhere in the interview, are how we came up with these numbers. And we just found it interesting to separate by county agencies and other stakeholders because they're really bringing different perspectives, sort of internal versus external in a lot of cases. And so here you can see all of these different barriers that we're going to go through in a little bit more detail. You can see that there's the steps that John was talking about, as well as some sort of like perceptions and fears that might keep people from applying. And the special population concerns are going to be sort of woven throughout. Okay. So we're going to go through the barriers chronologically as an individual would experience them. So we sort of divided this into pre-enrollment, so perceptions and fears, enrollment, the steps, and then reporting and recertification once you're in the program. So the first barrier that we'll talk about is misconception. So 4 agencies and 3 other stakeholders talked about this as a main barrier for them. And they didn't see awareness as being a huge problem, but they really felt like a lot of people didn't realize whether the eligibility rules would mean that they would be able to receive the benefits or not. And one way that this happens is that people are confused about the different changes in the rules that John was explaining earlier. So people might assume that there's still an asset test, or that because they have a drug felony they won't be eligible. And finally, there's a lot of confusion when you're applying for benefits about, if you're applying for Medi-Cal at the same time, or maybe CalWorks, it can be confusing to think about whether there's eligibility that works across the programs as you might expect, or not, which is the case. And there was also some confusion we heard about eligibility regarding, people who are working, people who have children, and students, as John was mentioning, is a really confusing category especially. So even if you don't have these misconceptions, you might encounter some stigma about the program. So this was a big thing that we heard from 5 agencies and 5 other stakeholders that listed them as a main barrier. And what is stigma? Well, we didn't hear a lot of clear definitions, but this was one of them that was pretty good. So really thinking about the U.S.'s approach to welfare and thinking about it over the years. And it seems like from some comments that it sort of breaks down into embarrassment about having need for the benefits, and then also denial that you have that need. So one recipient said this to us about using her for benefits. And this was a sentiment that someone else heard from recipients, or potential And then finally, even if you don't have misconceptions, you don't have stigma, if you're in a mixed status family where, you know, some of your members might not have legal documents to be in the United States, or even if you're just a recent immigrant who knows a lot of people and has really, you know, is afraid of interacting with the government, we heard a lot about this. So 2 agencies and 6 other stakeholders listed this as a main barrier. And general fear about interacting with the government was part of that. And obviously heightened by rhetoric coming from the Trump administration in the last 2 years. And then also this issue of public charge. So currently immigration officers use in their determinations of someone's application for citizenship or green card, a determination of how much they've used benefits in the past. So if they're in a mixed status family, they might have had access to you know, cash welfare from the federal government, and that's counted against them because it might indicate that they will be a public charge in the future. And there's a proposed rule from the Trump administration to include SNAP, so CalFresh, and other in-kind benefits as well. And so this is creating huge fear. There's confusion about whether this has happened, when it's happening, and whether or not you know, it will affect them negatively in their applications.
Once people sort of work through those, once they actually start to apply, there are still a lot of tricky things. So what we are calling communication is a pretty broad bucket that includes getting in touch with people in the first place, and then communicating effectively with them once they're on. So this includes tricky language on the applications. Even in English, it's hard to understand and fill things out. And then, as this one mentions, and this one touches on more, there are translated documents, but several stakeholders talked about that the translations aren't great, and it's technical, so it's still very hard for people to understand. And then, in addition to actually communicating, mailing things to old addresses that haven't been updated, or having a lot of people who need the benefits but are homeless, so they don't have an address, so they don't have a consistent telephone number. All these communication issues arose a lot. The interview was a huge barrier that 9 stakeholders mentioned. And so, as John said, the traditional process of sending people a letter saying, we'll call you at this time, was not very effective. And then rescheduling itself was a huge issue for a lot of people. Even in more modernized, I would say, ways to communicate with people, there were issues. So if people didn't list a phone number on the application, couldn't reach out to them. The counties, as John said, often call from a blocked number. People often won't answer it, so then they'll have missed their interview time and have to reschedule. And then, of course, the mailing thing is tricky as well with the translating homeless populations. Verification, so proving you're eligible for the program, was also a barrier that 7 stakeholders talked about. So this can include not having documents that you need because they're tricky to get. One person talked about if you've been fired from a job, you may have to go back to that employer to get documentation. That's an unpleasant process. It may just be, you know, a lot of small documents they have to keep gathered. A lot of people may not know or have access to technology options to upload documents. So now people can take photos of them in some counties, or you know, use their phone, but that's hard for a lot of populations, especially elderly people. So I like this one. So that's hard, even though counties are trying to make it easier. People may not know what documentation they need, and if you mess up your verification, it adds time to the enrollment process, so you may just give up. One stakeholder also mentioned that in observing case workers actually asking for verifications, sometimes people are over-verified, they're asking for things, or they're asking for more, or different kinds of things that are required by federal law. And then the reports and recertification, we encounter a lot of the same barriers. So recertification, for example, you have to redo the interview. So it's all of the same barriers that you encounter in the initial application, but every year. Being aware, remembering that it's coming.
Great. So, as Molly and Angela have mentioned, in addition to enrollment barriers, our team surfaced some structural barriers, and while our research didn't focus explicitly on this, we thought it was important to include given the potentially outsized impact it could have on enrollment rates and on the process that individuals experience when they enroll for CalFresh. So the first of these is the federal error rate. So the federal SNAP program regularly audits states to determine how much states are overpaying benefit recipients and underpaying benefit recipients as a quality measure. Both of those percentages are added together to determine the error rate. If states have a high error rate of payments compared to other states, they can receive sanctions. And so a number of stakeholders we spoke with mentioned that this particular quality measure is something that can often incentivize staff to err on the side of over-verification or even denials when it comes to the CalFresh program. Second is that there is no framework for continuous improvement. So currently counties and states don't have a structured method of incorporating ongoing feedback from clients and staff into their process of improvement, which can impair their ability to make ongoing improvements. Third, California, as John mentioned at the beginning, CalFresh is a county administered system, and while this in and of itself isn't inherently bad, it does create 58 different small CalFresh programs that have a tough time coordinating and may have their own disparate business processes. It also means that the state is not in a position where it can exercise a certain amount of control or authority over the counties, and sort of needs to be careful with how it balances that, which results in there being fewer state accountability measures that hold these counties to certain performance outcomes. Also, a number of our interviewees mentioned that counties can have a legislative influence over certain bills, especially those that seek to place restrictions or performance targets on them out of fear of those performance targets being tied to different sanctions. And so they tend to have advocates that push back against that type of legislation. And then finally, disparate IT systems. So this is an area that California is actually making a lot of progress on. But currently, CalFresh has 3 different back-end IT systems that help with applicant tracking and facilitating verifications. But given that it's on 3 different systems, it can be difficult for the staff to manage information on all 3. Currently, California is integrating these systems, but as it currently stands, this still poses a potential structural barrier to enrollment. So, to quickly summarize our findings from our 3 research questions. So first, as we went through, there are both enrollment barriers, such as interviews and verifications, as well as larger structural barriers, such as the ones I just mentioned, that can impact enrollment rates. 2, there are certain populations, especially seniors and students, that face particular challenges when applying for CalFresh. And finally, current proposed legislation is actually focused on much of these issues, both enrollment barriers and structural barriers, as well as policies that support seniors and students. And so based on these findings, we developed state policy recommendations that are based off of what we found to be some of the main barriers, but incorporate a lot of what the current proposed legislation aims to do. So, We defined two broad categories for our policy recommendations. The first are priority recommendations that largely focus on the enrollment process and can be implemented within the current administrative structure. So this includes improvements across the enrollment process as well as population-specific improvements. The second bucket are these comprehensive recommendations. So these are ones that involve larger plays by the state to address existing structural barriers. So this includes horizontal integration, combining different aspects of different public assistance programs, as well as potentially implementing some statewide participation targets to create that accountability structure that is present in other programs. So first, for improvements across the enrollment process. So interviews, as you remember, is one of the top barriers. And to address this, we focused on elevating different county approaches. I won't go through each of these, but that includes such things as telephonic signatures that John was discussing earlier, as well as adopting flexible interview practices. Second were verifications, another one of the top barriers. And so here we heavily relied on recommendations from a recent study from a nonprofit group that looked at verifications specifically for CalFresh as well as the larger public assistance programs in California. And so this includes recommendations such as streamlining the online verification process, training county staff, and expanding access to current data sources that can help to facilitate the verification process. And then finally, there are some policy suggestions that apply across the enrollment process. So this includes such things as translating applications and notifications. Currently, this is only really done well for Spanish and not done as well for other languages, as well as issuing guidance on how counties can revamp their reminder and notification system. So each of these recommendations map to specific barriers that we identified earlier. So second are population-specific improvements. So for seniors, each of these populations, there are currently bills that aim to address enrollment issues with all three, and so we highlight those here. So for seniors, one bill recommends developing a simplified user-centered application that extends the recertification timeline and streamlines the verification process to sort of tackle this low enrollment rate of 18 to 20% for seniors. For students, many are currently unaware that they are eligible for CalFresh if they are participating in a qualified federal or state work-study program. And so as such, this bill recommends distributing and creating a standardized form that can help students to verify if they qualify for this program and then subsequently apply. And then finally, one population that we didn't get into as much, able-bodied adults without dependents. So currently these individuals are limited to 3 months on CalFresh within a 3-year limit. Unless they meet certain strict work participation requirements. And so one bill recommends maximizing the use of individual waivers. And so currently, as John mentioned, the state has different options that they can use to grant leniency or waivers from different requirements. So one of those is for ABOD, where they're able to get waivers for individuals in areas that might have a high unemployment rate or a lack of jobs available. And so this bill recommends maximizing the use of those existing waivers. However, it also calls for establishing a new state-funded program that would help replace lost benefits from CalFresh, because all these waivers are expected to expire soon. And so while the state is trying to renew these, that's not necessarily going to happen. So now shifting more to our comprehensive recommendations, the first of which deals with horizontal integration. So this strategy came up in several of our interviews, given a desire that stakeholders had to move from benefit programs from program-centric to client-centered to be a more holistic approach and really user-centered design approach. However, given the difficulty in the past with implementing or passing horizontal integration legislation, we both recommended near-term and long-term approaches to horizontal integration. So the first in near term is there are opportunities for instituting what's sometimes called express lane processing. So this already occurs for individuals who are in CalFresh and want to enroll, for individuals who are in CalFresh and want to enroll in Medi-Cal, but not necessarily the other way around. And so there are opportunities to work with programs and individuals and programs that have similar eligibility criteria to CalFresh and help them get into CalFresh more quickly than the usual process takes. Another is to just increase general coordination and collaboration amongst benefit programs. So this includes things like sharing data on different verifications that are related to one specific individual, or aligning reporting requirements across the different benefit programs to reduce the burden that individuals face when having to report changes to their income or other things. Long term, we recommend both creating a universal application for benefit programs, as well as creating a universal or central data hub to facilitate verifications. So these are two policies that are sort of increasing in popularity as a number of stakeholders and research groups advocate for this. And so, while it requires an extensive change to the current system, it is incorporated in current bills and in current implementation plans, which is exciting. And finally, in an effort to create an accountability structure in California that helps to mitigate the effects of the federal error rate to some extent, California can institute statewide participation rate targets. Though legislating participation rate targets has been difficult in the past, given concerns from county agencies, we believe that under the current Newsom administration, this might be possible, given his tendency towards creating statewide accountability for different programs, including education. So this might be something that has a better chance of passing in this political environment. So this has three components to it. So the first is setting the target themselves. So here is a proposed plan from one Senate bill that notes having a target of 75% of eligible individuals enrolled by January 2021, going all the way up to 95% by July 2024. The second part involves supporting counties and engaging in a process of continuous improvement. So this involves both those counties that don't meet the targets, helping them to develop and implement a plan that incorporates ongoing feedback to continuously improve, as well as supporting them in using specific access improvement measures, such as telephonic signatures, flexible interviewing, a lot of the things you mentioned earlier. And then finally, states will play their part in this by supporting county efforts, both through helping to conduct ongoing user experience research with staff and with benefit recipients to inform improvements to the program, and supplying them with relevant data on how the participation rates might differ across geographies or different demographics to inform their plans for improvement. So that's it for the recommendations. In terms of next steps, we are meeting with our client, Senator Stern, this Wednesday to share and discuss our findings and recommendations. And as part of that, we'll be recommending the specific bills that he can vote for or support, and just those recommended action steps he can actually take towards this goal. And then we'll also be sharing the report and findings with different CalFresh stakeholders that we spoke with to support them in their efforts, however it might be applicable. So that's it. Thank you so much for your time.